Hello everybody, my name is Dr. Shadi Arafij and I'm a board-certified veterinary surgeon. This video is part 3 of our Cranial Cruciate Ligament Disease series. I hope this video will add to your current understanding of this condition in dogs and allow you to make an informed decision regarding your pet's care. Remember to always follow the recommendations of your veterinarian or veterinary specialist closely. Today we will focus on one of the many corrective surgical techniques used for cranial cruciate ligament, or CCL, rupture in dogs. This surgery is called the Tibial Plateau Leveling Osteotomy, or TPLO. Now please visit the links below regarding what causes the CCL tear, and also watch a video on another surgical technique known as the lateral suture technique. Now the TPLO procedure is in a class of surgeries called osteotomies. These are bone surgeries that are used to indirectly replace the functions that have been lost by the torn CCL. The TPLO is only one specific type of osteotomy, but it is the osteotomy that I will perform on my patients. The TPLO is based on the premise that the tibial plateau angle, or TPA, in some dogs with CCL tears is higher than normal. This high angle creates a sloping of the tibia, predisposing to tearing of the ligament, as shown here by the red lines. Now the goal of the TPLO surgery is to decrease this angle. Based on measurements by the surgeon, a semicircular cut is made into the tibia, allowing to rotate the top of the tibia in a caudal direction, resulting in what is known as tibial leveling. And that movement is shown by the red arrow before and after the cut is made. By leveling the tibia, this creates a level surface, neutralizing the forces that are placed on the knee. The bone is then stabilized by a specialized bone plate and bone screws. Now over the next 8 to 12 weeks, depending on the individual patient, this osteotomy will heal and the patient will begin bearing more weight over time. The implants are meant to remain in the patient for life, and uncommonly the implant needs to be removed. Removal of the implant should not reverse the surgery. The majority of pets are hospitalized for 24 hours after surgery to ensure a complete and safe anesthetic recovery and to maximize their comfort after the surgery. We want to make sure they're eating well and feeling good before going home. Upon discharge from the hospital, surgical staff will review the discharge instructions, the medications, the aftercare, and whatever further follow-up is needed. Some will go home with a bandage and some will not. It is vital that the post-operative instructions are followed carefully to avoid complications. Aside from the generic complications that can occur with any anesthesia or orthopedic surgery, there are some complications unique to this procedure. The implants can loosen or pull out of the bone. Other ligaments can be traumatized, especially the medial meniscus ligament, which is located in the knee. Infection of the incision of the implants can occur, especially if the pet licks the incision. The implant can cause a rejection or reaction requiring implant removal. I've seen patients even fracture the bone or fracture the implants involved. Overall, the surgery has an excellent outcome, with the majority of pets healing fully and being able to resume normal activity. This will depend, of course, on your ability to follow the post-operative instructions and on the assumption that your pet heals as expected. The arthritis will form, however, in the knee of these patients, but the amount of arthritis that forms and how badly it will affect your pet is really unique to your own dog. Now, I thank you so much for watching. Check out my next video regarding CCL tear that compares the lateral suture technique and the TPLO surgery in general. Thank you so much for your time. I hope this video will add to your current understanding of this condition in dogs and allowing you to make an informed decision regarding your pet's care. As always, follow the recommendations of your veterinarian or veterinary specialist carefully. Please show your support by subscribing, hitting that like button, and sharing this video with others. This is Dr. Shadi Arafij. Let's take care of our pets. Thank you.